All right, let's talk about something we all deal with, healthcare. We're going to take a trip down to Athens, Georgia, to look at what feels like a small revolution happening at one medical center. They're asking a pretty simple but kind of radical question. What if your doctor's main job wasn't just fixing you when you're sick, but actually being your partner in staying well? Let's dive in.
You know the drill, right? You wait for weeks to get an appointment, and when you finally get in, it feels like you're on a conveyor belt. You're in, you get maybe a few minutes, a quick prescription, and then you're pushed right out the door. It always leaves you wondering, does my doctor really have the time to listen to me? Well, that feeling, it's not just in your head. It points to a much bigger problem in our healthcare system.
And that's what we're going to call the primary care challenge. See, the system is so often designed to be reactive. It just kind of waits for something to go wrong and then swoops in to try and fix it. But that whole approach can feel super impersonal, super rushed, and it leaves a lot of us thinking, man, there has to be a better way to do this, right? And here's the heart of that problem. So much of healthcare feels like it's one size fits all. We get treated based on these standard procedures and protocols, not on our own unique situations, our lifestyles, or what we actually want for our health. And this is the exact philosophy that one clinic in Athens, Georgia is really trying to flip on its head. So if that's the problem, what's the solution? Well, in Athens, the Gowdie Family Care Center is putting forward this new patient-first mission. And they're not just talking about making a few small changes here and there. Nope, they're trying to fundamentally rebuild the entire doctor-patient relationship from the ground up. And you can hear it in their own words. Their mission is pretty bold. They want to provide unparalleled primary care. But how? By shifting the entire focus away from just getting more people through the door and onto building real, genuine relationships with every single patient. It's a pretty ambitious goal, and it totally redefines what success even means in healthcare. Okay, so patient-driven care sounds awesome, but it can also sound a bit like marketing jargon, right? What does it actually mean for you, the person walking into the doctor's office? Let's get into the nitty-gritty of what this really looks like. So at the core of it all is this idea: patient-centric care. It's a model where you, yes you, are at the absolute center of every single decision. Your care plan is built around your specific needs, your personal preferences, and what you value most when it comes to your health. The key here is that it's not about trying to squeeze you into some pre-made box. And you can really see the difference here. Traditional care, it's often reactive. It's about treating symptoms after you're already sick. But this new approach, it's all about being proactive. It's about preventing problems before they even start. It moves away from that one-size-fits-all playbook and toward a totally individualized strategy that's focused on your overall wellness, not just your symptoms. And this whole philosophy really stands on three big pillars. First, it's about personalized preventative care, not just generic advice you could find online. Second, there's a huge focus on lifestyle changes as a real, powerful tool for your health. And finally, it's all about the early detection of health risks, trying to get way ahead of problems before they become serious. So what does this actually feel like for you as a patient? Well, your journey starts with a really comprehensive assessment to truly understand who you are. From there, you co-create a personalized plan. But honestly, the most important part is that last step. This is not a one-and-done visit. It's all about building an ongoing partnership where your doctor is truly on your team for the long haul. And of course, this patient-first philosophy is backed up by a whole suite of services. We're talking everything from family health for adults and kids to specialized women's health and ongoing care for things like chronic diseases. The whole idea is to provide everything your family needs all under one roof. Now, a mission this big needs a serious foundation of trust and expertise, right? And this isn't some brand new facility just trying to figure things out. This is actually an established practice that's evolving how it delivers care.
Yeah, a change like this doesn't just happen overnight. The Gowdie Center has been building trust in the Athens community for over a decade. That 10+ years of history, that's the bedrock that makes this kind of evolution even possible.
And leading the charge is Dr. Erica Gowdie herself. She has made sure that her entire team of physicians has specialized training to actually put this new patient-first model into practice. So it's not just a nice-sounding mission statement on a wall, it's a completely new skill set for the entire clinic. So what does all of this add up to? What's the real on-the-ground impact of this big shift for the people who actually live in and around Athens, Georgia?
When you boil it all down, it really comes back to one crucial word: trust. The center sees this new model as a way to further bolster the confidence that the community already has in them. It's like they're making a promise that their commitment isn't just to medicine in general, but specifically to the health of the people of Athens.
So what's the big takeaway in all of this? For you, the patient,
This model means you actually get more time and real attention from your doctor. It means you get a healthcare plan that's tailored to your life, not just some generic textbook. It means you get a genuine partner in your long-term health. And maybe, just maybe, it offers a chance to renew your trust in what primary care can and should be.
You know, it leaves us with one last question to think about. We personalize everything these days, right? From our coffee order to our playlists to our news feeds. So isn't it about time our healthcare was finally built around the single most important person in that room? You?